Baystate Health has 30 patients hospitalized with COVID-19. 2 are in critical care units. Baystate's top infectious disease specialist says the number of cases in Western Mass and the state are still low, but much work is needed to be done to keep it that way. So Beth Ward sat down with an exclusive interview for a doctor about how they're seeing a slight uptick in cases.
So our first case here at Baystate Health was in mid-March, our first COVID case. And for the next 6 to 8 weeks after that, we were in the midst of a pretty impressive accelerated surge.
For the first time since the pandemic hit, Dr. Andrew Artenstein, Baystate's chief physician executive and infectious disease specialist, sat down one-on-one, socially distanced, for a local television news interview. He says the number of COVID-19 cases have stabilized, with some hiccups along the way.
Since that time, we've seen a steady decline from about early June till the end of July. Then we saw a brief blip and then back down into the range where we have no more than 24 patients in hospital at any moment.
What is concerning, he says, is the upcoming cold and flu season, symptoms of which can mimic that of COVID-19. The hospital is preparing to test all patients regardless for COVID and the flu. However, a new single test is in the works.
There's work in progress to develop a test that is a single test that will incorporate more than just one virus, and we should have those, we hope, by sometime this fall.
Right now, the focus is on quicker turnaround times for testing.
It would be helpful for your viewers to understand that it is improved, and the reason it's improved is by, frankly, brute force on the part of laboratory professionals and clinical professionals and companies.
In-hospital testing results take anywhere, he says, between 4 and 9 hours. Outside the hospital, days, which he says must change if we are to get ahead of this virus.
There's been no national coordinating, unifying theory behind this, which would have helped and would help still. Everyone is kind of on their own and doing the best they can, but a lot of these constraints are beyond our control.
As several vaccines are in human trials here in the U.S., Dr. Artenstein is skeptical of Russia's claim to have one available for the public until more information is known.
It was tested in 76 people by report. That's a small number. That doesn't prove anything. That's a good start. That would be considered to be a pilot study in most American vaccine trials.
The good news here in Massachusetts, he says, the infection rate is inching down right now.
I can tell you in Massachusetts, the infection rate as of yesterday, that is the rate of positivity among tests done, it was 1.8%, which is a pretty low percentage.
Meaning about 1 to 2 people in every 100 people are infected with COVID-19. Still concerning odds when it comes to kids going back to school.
Knowing that, it tells you if you get 500 students in a cafeteria and 2% are infected, that's 10 kids, right?
Again, calling on a national coordinated effort.
Frankly, if it had been our national strategy 5 months ago to work towards a strategic plan to strategically reopen schools because it was so important and we had 4 or 5 months to prepare, I think we could have been in a better place.
What we need to focus on now, ahead of another anticipated wave of the virus, he says, are the basics.
It almost sounds trivial at this point. We talk about it so much, but they actually work. Those public health practices that work to keep you safe and to keep those around you safe. Wearing the mask when you're not alone. Avoid large gatherings. Avoid high-risk travel if possible. Washing hands early, often, and appropriately.
Dr. Artenstein gives Governor Baker high marks when it comes to a slow reopening, and he also gives high marks to the governor's recent step back on step 2 of phase 3. Reporting live from home, Beth Ward, Western Mass News.